In this webinar, we will learn elements of bundle care approach and how they can be put into practice. A bundle is a set of evidence-based practices that when performed collectively and reliably are expected to improve patient outcomes. The individual components of the care bundles are evidence-based practices which are associated with better clinical results. The implementation of care bundles replaces the existing practices of patient care and are expected to result in better patient outcomes. Whole clinical team agrees to these practices and is responsible for implementing them in the unit. The best results are obtained when the care bundles are implemented collectively and reliably. For example, for improving intravenous line handling in a unit with high incidence of invasive bloodstream infections, the local healthcare team selects a set of evidence-based interventions, combine them to form a bundle and strives to implement it consistently and reliably in order to reduce incidence of bloodstream infections. A care bundle for any invasive procedure consists of interventions which usually range from 3 to 5 in number. It is seen that the compliance is best achieved when the number of interventions are limited to 3 to 5. The crux of making care bundles lies in identification of key steps of performing the invasive procedure and identification of key interventions related to these steps. The key interventions are based on the results of high quality studies, for example, systematic reviews or randomized controlled trials. The care bundles, that is group of evidence-based interventions, must be implemented together in order to improve the outcomes. The clinical care team takes responsibility of implementation, surveillance and auditing the execution of care bundles in order to ensure the continued change. Let us discuss an example of care bundle to prevent peripheral intravascular cannula related infections. Following steps should be undertaken to form the same. Step 1 is enumerating the steps related to placement of peripheral intravascular cannula as well as nursing care related to maintenance of peripheral intravascular cannula. In the second step, the team identifies 3 to 5 most important steps from the step 1, which are critical for prevention of bloodstream infections related to peripheral intravascular cannula insertion and its maintenance. These critical steps may be common or may vary slightly when identified by different healthcare teams for making care bundles for their respective units. This variation may be related to existing unit practices, beliefs, equipment supplies and healthcare resources. One such example could be number 1, duration of intravascular cannula, number 2, lapses during the procedure of peripheral intravascular cannula insertion, number 3, lapses during handling intravenous lines during day-to-day nursing care, and number 4, repeated puncturing of antibiotic vials or saline ampoules. In the third step, the clinical care team identifies best evidence-based interventions to answer each of these 4 problems. Then select the most important 3 to 5 interventions which form the care bundle for peripheral intravascular cannula insertion and maintenance. One such example of the care bundle related to the step 2 is as follows. Number 1, daily documentation of the necessity of intravascular line by assessing whether the baby is eligible to be initiated on enteral feeds. Number 2, strict implementation of aseptic non-touch technique while placing peripheral intravascular cannula. Number 3, all injection ports and hoops to be cleaned with antiseptic swabs before each use. And number 4, strict avoidance of repeated punctures of drug vials or intravascular fluid ampoules. It is of utmost importance to provide education and improve communication amongst the unit staff for implementation of the bundle care components. The bundle care cannot be adequately implemented unless all unit staff promotes its operationalization. These teams can be created from the pool of healthcare professionals, for example, doctors and nurses working in the area. However, the guidelines can be taken from the allied departments, for example, in the above case from departments of microbiology and hospital infection control committee. It is equally important to periodically check whether the care bundles are adequately implemented. Furthermore, whether the care bundles are resulting in the desired outcome, for example, decrease in bloodstream infections in the above case. Therefore, periodic audit of the practices and outcome indicators must be undertaken by the team members. It is also important to regularly appraise the members of the unit about the results of the audit. It also gives an opportunity of positive reinforcement for the promotion of care bundles. A positive change increases the morale of the healthcare providers for better healthcare delivery. To summarize, in this webinar, we have learned about bundle care approach can be an attractive way of infection prevention. Careful selection of strategies of bundle care for focused intervention is the backbone. It allows implementation of 3 to 5 evidence-based interventions which are implemented together. It integrates the team approach, auditing and regular reporting of results to the healthcare staff. Thank you.